The vote to repeal the Affordable Care Act has been postponed until March 30th because as of now, it might not actually have the votes to pass. And furthermore, they're also postponing this vote, presumably because if you repeal the Affordable Care Act without actually having a replacement, that will be an unmitigated disaster, and Republicans will undoubtedly pay a huge political price because of it. Now, the problem is that if you repeal the Affordable Care Act and this new healthcare bill, which the prospect that it actually will pass is diminishing every single day, doesn't go through, then you just repeal the Affordable Care Act and you throw millions of people off of their current health insurance. They lose their subsidy. So that is something you don't want to do. And as this new bill that they've proposed loses popularity, and even as more conservatives come out against it, well, repealing the Affordable Care Act becomes more and more like a dim-witted decision, hence why I think it was postponed. Now, Bernie Sanders was on MSNBC to talk about the new healthcare bill, and he completely shredded it.
I think it's probably wrong to refer to this legislation as a healthcare plan. Its primary purpose is to give some $300 billion in tax breaks over a 10-year period to the wealthiest 2%. It is a tax plan to help the very wealthy and the pharmaceutical industry and the insurance companies with huge tax breaks. In terms of the essence of their so-called plan, as you know, they're going to throw some 24 million people off of health insurance, defund Planned Parenthood, and according to the AARP, if you are 64 years of age and you're trying to get by on $25,000 a year, your health care costs are going to go up from $1,700 today to $13,000. And as you've just indicated, as difficult as the deductible situation is now, and it is a real problem for millions of people, this plan makes it even worse.
What? I mean, I know you think that this is primarily driven, this is basically a tax bill. It's a tax cut that's got health care wrapped around it. But if that's the case, why are they going through all the trouble to do this when they could just like straight up pass a tax cut? I just don't get it.
Well, Chris, trust me, they're going to do that as well. I mean, coming on down the pike are massive tax breaks for the wealthiest people in this country. But this is the start. But there is something else involved in this legislation. And that is, this is the implementation of the Koch brothers ideology, which wants to basically eliminate every piece of legislation passed in the last 80 years, which protects the elderly and working people and children and the sick and the poor. These guys believe, and this is the Koch brothers, that government should not play a role in helping people in need or working people. So what this bill does is decimates Medicaid. It will make Medicare less solvent, cuts 3 years of solvency off of Medicare, and they're going to come back with more and more cuts to programs that working people need. And by the way, remember, this is from a president who campaigned, the guy who campaigned as a champion of the working class. This health care proposal and their budget will be horrific for working class families all over this country.
So everything that Bernie Sanders is saying is exactly what every single Democrat should be saying. They should all listen to what he's saying and use that same rhetoric, because Bernie Sanders is correct here. And, you know, one part of this interview was interesting. Chris Hayes said, well, you know, why would they not just pass a tax cut for the rich? Why would they have to go through all the trouble of making this about healthcare? And, you know, it showed that he's naive, because they always do this. They put tax cuts for the rich in all types of bills. This is the way that Washington works. You're a political pundit on MSNBC. How do you not know this? But I mean, they do this all the time. And Bernie Sanders even stated they will. They'll do a standalone tax cut, but another tax cut. I mean, in sum, if you take all the tax cuts that they squeeze into bills, well, you have a pretty big portion of money that's going to be funneled back to the billionaire wealthy class. So this is the way that they operate. Now, one thing that Bernie said I wasn't so sure about, he states that, you know, even though this is the type of legislation that the Koch brothers support, I don't necessarily believe that the Koch brothers are backing this bill, because they're apparently threatening to withhold funding from Republicans who do support this bill. But I mean, all of this points to the elephant in the room with Bernie Sanders talking about how shitty this healthcare bill is and how Obamacare is broken and needs to be repaired. This all points to single payer as the end-all be-all. I mean, I think that at this point, the American people should accept nothing less than a single payer system, because how how many more bankruptcies, how many more deaths do we have to witness in this country before we get our act together and join every other modern industrialized nation and offer single-payer healthcare to every single citizen? I have no problem paying more in taxes if I don't have to pay for my monthly healthcare premium, which is already too expensive. And by the way, my deductible is $6,500. I can't afford that. So if I have a medical emergency, I risk going bankrupt. Some people who don't have insurance or still do have insurance end up going bankrupt anyway, or they die. This is not what you are supposed to do if you're the government. As government, it's your duty to take care of citizens. You take our money, taxes, in return for goods and services. And part of that is, you have a military, so you protect us from external threats. And also, you make sure that we don't die if we get sick. I think it's pretty simple. Philosophically, I don't see how you can be against healthcare. And just morally, how can you be against the single-payer system? How can anyone be against this? The only people who are against this are stooges of the health insurance industry. These politicians take money from the health insurance companies and the pharmaceutical companies, and then they do their bidding. And they know that they have to craft healthcare policy within the confines of the private insurance industry, which continues to rip us off, because, if they create a single-payer system, then that whole insurance industry goes away. It becomes non-existent. And they don't want that. And the health insurance industry, certainly they see single payer as an existential threat. And they should, because they would go away because of it. But when it comes to a capitalistic society, yes, we're going to economize certain things. Healthcare is not one of them. The goal of healthcare should not be to increase profits. The goal of healthcare is to provide health care to people. It's in the name, care. We give care to people. That's the operative term here. And you can't do that if you prioritize money over the well-being of people. So what Bernie Sanders is doing here, I think it's important because, what he says has a lot of weight behind it. He's the most popular politician in the country. And as he continues to stump for single-payer healthcare system, as Americans continue to realize that they're being screwed over and they're getting a bad deal, they're not getting what the Canadians or the British are getting. They're beginning to realize that a single payer is a necessity and we have to demand it. We should accept nothing less.
You've all heard me say this before. Moving from an opposition party to a governing party comes with growing pains. And, well, we're feeling those growing pains today. We came really close today, but we came up short. I spoke to the president just a little while ago, and I told him that the best thing I think to do is to pull this bill, and he agreed with that decision. I will not sugarcoat this. This is a disappointing day for us. Doing big things is hard. All of us, myself included, we will need time to reflect on how we got to this moment, what we could have done to do it better. But ultimately, this all kind of comes down to a choice. Are all of us willing to give a little to get something done? Are we willing to say yes to the good, to the very good, even if it's not the perfect? Because if we're willing to do that, we still have such an incredible opportunity in front of us.
Support this podcast by joining the independent progressive media revolution today at humanistreport.com.